Hi, I'm Dr. Ali Warrick, UC Davis Sports Medicine Fellow.
And my name is Dr. Kevin Mullins, Assistant Professor at the University of California, Davis in Sacramento, California. Dr. Warrick and I are so excited that you're here with us virtually today. We will be taking you through the clinical models of exercise medicine and physical activity promotion. Let's go ahead and get started. You made it to the outline slide. Welcome. So this is just talking about what you and I and Dr. Warrick will be going through together today. Just remember, there is a disclaimer that our recommendations today are a general recommendation. Each patient should have a risk assessment because the same exercise is not recommended for everyone. There are medical comorbidities that you must consider when prescribing an exercise recommendation to your patient. Okay, so let's get started. The amount of healthcare expenditures has continued to expand in 2021. Increasing activity is the best low-cost treatment for improving health conditions. Regular physical activity at any body weight is crucial for healthy weight management. Exercise is an effective prescription for a variety of common chronic illnesses. The discussion of exercise in medicine should be integrated into every clinic on a daily basis.
Thank you for joining me as I'll be demonstrating practical ways to engage patients in a discussion about physical activity and exercise. My goal is to present a judgment-free environment that accepts patients as they are and focuses on setting realistic goals with stepwise progress and accountability. I'll be reviewing motivational interviewing techniques using open-ended questions to get the conversation going. I'll be listening to my patients' needs and thinking about their goals before making suggestions. And it's important to recognize that it isn't easy to make a change. It takes courage, determination, and persistence. So it's important to remind patients about giving themselves a break if they don't meet all of their goals at once. So, clinics are busy. If you only have 1 minute to engage a patient about exercise and physical activity, let's start with the physical activity vital signs. Let's review.
Thank you so much, Dr. Warrick. So what are the physical activity vital signs? Well, it's very easy. We have days, minutes, and total. So up here at days, what are we gonna have? We'll have on average, how many days per week do you engage in moderate to vigorous physical activity, like a brisk walk? Then we have the patient fill out how many minutes on average do you engage in physical activity at this level. And then in the total compartment, you take the minutes per week of physical activity. You get that by multiplying the days by the minutes. And this is your physical activity vital. And so these questions can be asked either during the clinic visit or they can be included on the intake sheet. This gives a brief time snapshot of their current level of activity, and this can be compared to national guidelines that we will review. Additional follow-up information can be given in the after-visit summary with the resources. So let's take a look and see how the physical activity vital signs might be integrated into a 1-minute patient encounter.
Hi, Abigail. How do you feel about your weekly amount of exercise?
I feel okay, not great about it.
Could it be improved?
Yeah.
Okay. So on average, how many days per week do you exercise?
Usually 3, I go for a walk.
Okay. How many minutes are your walks?
Usually 30 minutes.
Okay. So that's 90 minutes per week. National guidelines recommend 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise. Moderate exercise is having some difficulty talking while exercise, and vigorous, you're definitely having difficulty breathing. Do you think you could increase your weekly amount of exercise?
Yeah, I just need to be better about sticking to it.
Okay. Do you have the tools or resources that you need?
I think so. Do you have any recommendations?
Yeah, I recommend scheduling your exercise time in your calendar. potentially increasing to 4 days per week. Give you some resources, and then we'll check in next time we meet about how it's going.
Sounds great, thank you.
Aha, welcome back. So I hope you enjoyed that video, and it gave you a brief example. If you had 1 minute with a patient, what could you say during that time? So let's just review for a quick moment. The national guidelines recommend 150 minutes per week of moderate intensity physical activity. Alternatively, you may complete 75 minutes of vigorous intensity activity, or an equivalent of a combination of both moderate and vigorous intensity physical activity. Now, it's important to remember 1 minute of vigorous activity equals about 2 minutes of moderate activity. And this can be split up throughout the day. So you might be asked by your patients, what exactly is moderate intensity versus vigorous intensity activity? Well, let's review. Moderate intensity, you're walking, you can talk, but not necessarily sing. So this is gonna be a really brisk walk, right? Or maybe a biking, slower, doubles tennis, doing chores at home, or maybe even gardening, depending upon the level of activity. This is different though than our vigorous activity. So vigorous intensity is you can no longer talk. You're really jogging and you are huffing and puffing. You are short of breath. So jogging, faster biking would be in that category. Singles tennis would also include an aerobic kind of exercise in addition to swimming laps. So we have our moderate and our vigorous intensity activities, and it's good just to remember which is which. All right, so that brings us into something called SMART goals, and you've probably heard of this before, but let's go ahead and review. These are goals. This is the way that you want to be developing your goals with your patient. So SMART stands for specific, measurable, attainable, realistic, and timely. So specific, you want something to be specific, otherwise how will you know what you are working toward or when you have attained it? You want something, of course, to be measurable. A goal needs to be measurable so you can track your progress and document your success. You want something to be attainable. Set yourself up for success by setting attainable goals that will leave you feeling successful. Realistic, now it's fun to dream, but it's also important to tell your patients that they need to be realistic with their goals. And then lastly, we have timely. In order to be useful, goals need to have a time frame. Without a time frame, we have no motivation to take action. So a couple examples of SMART goals, and you can freeze this video right here. We listed 10 for you. What do you want to work on? Shall we brainstorm? Or how will you track your progress and stay accountable? So let's go ahead and jump into our 3-minute example video and see which SMART goals Dr. Warrick integrates into her conversation today.
Hi, Abigail. What are your exercise goals?
I want to try to be more consistent. I know I need to be healthier, but it's hard to be accountable when I'm exercising by myself.
Yeah. It sounds like you've made efforts in the past, but it wasn't as consistent as you'd like. You mentioned you'd like to be more accountable and you face difficulties motivating yourself when exercising alone. Do you have someone to exercise with or someone with similar goals?
Well, right now my schedule's so busy and my work hours are so variable, it's hard to coordinate. I'd rather just be more consistent with it.
Okay, sounds good. I recognize you're already putting in the work 3 days per week to exercise. How do you think you could be more consistent?
I don't know, I just have to be better about it.
Okay, well, let's be more specific and brainstorm ways to make it work for your schedule.
Well, I try to go for walks when I get home from work, but I'm so tired I just want to sit on the couch. I could try to go for walks in the morning instead.
That's a great idea. Since this is an adjustment to your schedule, let's start slowly.
Okay, I can start with 2 days a week of morning walks.
Okay, and if it goes well, do you want to aim to bump it up to 3 days in the morning and eventually 4 days?
I could do that.
Wonderful. When do you want to start?
I can start tomorrow morning.
Sounds good. How will you track your progress and stay accountable?
I'll set a reminder alert on my calendar.
Okay, great. And if you meet your exercise goals this month, how will you reward yourself?
Oh, I'll buy a new pair of walking shoes. I've been meaning to do that.
Wonderful. I'll give you some resources about how to track your steps on your phone and other resources in case you'd like to mix up your exercise routine with other activities. This will include a QR code to exercise videos and suggestions about small changes to spice up the exercise routine. Next time we meet, we can check in about how it's going.
Great, thank you.
You're welcome.
Welcome back, everyone. I hope you enjoyed that video, and hopefully you found it a bit educational as well, as far as how you can integrate SMART goals into a longer patient discussion in your clinical practice. So here are a few additional examples right around me in regards to SMART goal discussions and examples, some of which Dr. Warrick just integrated into this video. And we have to conclude with 4 basic take-home principles for motivational interviewing. These are principles you can integrate no matter what level of that spectrum they are on. Number 1, we want this to be a partnership. You should be collaborating with your partner. It never works when it's a one-way road. Number 2, acceptance. It's important to accept autonomy. Number 3, be compassionate. Be kind and certainly not critical of your patient when maybe they aren't quite at that contemplation stage quite yet. Then number 4, evocation. So the best ideas about change come from the patient. So listen to the patient, try and find those areas where perhaps we can motivate them to move forward. So thank you so much for joining us today for this brief talk on clinical models, exercise, medicine, and physical activity promotion. We leave you with the slide of a few resources that hopefully you find useful in your discussions with your patients as far as activity promotion. And as you look over the resources, Dr. Warrick would like us all to remember that one of the best exercises for medicine is that of dancing. So cue the salsa music and Dr. Warrick, take the floor.